Hello, my name is Brandon Fields, and I'm going to go over my presentation for caring for clients with chronic needs. This is for Nursing 404, Nursing Care and Management of Chronic Illness. The main objectives for this PowerPoint presentation are to understand the experience of individuals living with chronic conditions, explore the physical, mental, and emotional impacts of chronic illness, recognize the importance of addressing unseen conditions in the management of chronic health. To learn and apply best practice nursing interventions, we're going to identify and discuss best practices for nursing interventions to support individuals with chronic conditions. We're also going to apply evidence based on strategies for different age groups and specific chronic conditions. We're also going to enhance nursing care through patient and family education. We're going to do this by developing clear educational talking points that the nurse can reference with patients and families. We're going to tailor education to the individual's needs, cultural factors, and specific chronic conditions. To address issues related to social isolation, we're going to also address issues related to social isolation, health-related quality of life, and adherence. We're going to do this by understanding how social support and social isolation impact the quality of life. We're going to learn interventions to improve adherence to treatment plans and self-management of chronic conditions. We're also going to explore models of care and health policy related to chronic illness management. And then we are also going to apply care interventions based on specific diagnosis and the patient's needs. My name is Brandon Fields. I'm currently an RN in the emergency department in a busy, fast-paced emergency room. I graduated nursing school in 2019. I frequently encounter patients visiting the emergency department due to the patients not managing their chronic ailments. Before nursing, I was a paramedic on an ambulance for almost 10 years. And as a paramedic, I also treated and transported many patients who called 911 due to not managing their own chronic disease. Many patients were calling 911 for these unmanaged diseases like diabetes, hypertension, and cardiovascular disease. Before becoming a paramedic, I was a personal trainer and assisted clients in weight loss and fitness goals. I helped clients manage their chronic disease through exercise, as well as nutrition and lifestyle coaching. The illness experience of an individual with chronic conditions is deeply personal and multifaceted, affecting physical health, emotional well-being, and social interactions and identity. Unlike acute illnesses, which have a clear onset and resolution, chronic conditions are long-term and often progressive, requiring ongoing management and adaptation. The three main categories that these illness experience can lead to is physical impact, mental health, and the unseen. Physical impact is individuals with chronic conditions frequently experiencing persistent symptoms such as pain, fatigue, and mobility challenges. The unpredictability of symptom flare-ups can make daily life difficult, requiring adjustments in work hobbies, self-care routines. Medications, treatments, and lifestyle changes may help manage condition, but they often come with side effects and more burdensome regimens. The category of mental health, living with the chronic condition can lead to emotional distress, including anxiety, depression, frustration, and feelings of loss. Individuals may grieve their pre-illness selves and struggle with the uncertainty of their prognosis. Some develop resilience and coping strategies, while others may require mental health support to navigate their emotions during this process. Then there's also the unseen. Chronic disease has a greater toll than what can be measured or seen by healthcare providers. For example, a patient may suffer from chronic pain and chronic fatigue. These are the things that are not able to be directly measured or observed by clinicians. However, they can compound the issue of chronic disease and add to the frustration for the patient. We're going to do a case study for social isolation. A 7-year-old with hemophilia needs to some interventions for a 7-year-old with hemophilia is collaborate with a physical therapist. A specialist can design a low impact exercise program for swimming, cycling, and supervised gymnastics. To strengthen muscles and protect joints, they need to be able to do this safely because of the risk for bleeding. Education on injury prevention. Teach the child and caregivers about avoiding high impact sports such as football and hockey and the importance of wearing protective gear like knee pads, elbow pads, and helmets. Engagement in social activities. It's important to encourage participation in safe group activities like art and other sports to reduce feelings of isolation while promoting self-confidence and inclusion. Home and school modifications include work with teachers to ensure a safe environment, include minimizing fall risks, and having emergency bleeding plan in place. The intervention balances physical health, safety, and social well-being, helping the child stay active while managing their hemophilia effectively. Next slide. We're going to go over healthcare quality of life. Why isn't this working? Healthcare quality of life, it's a measure of how well individuals can perform daily activities and enjoy life in the context of their health. Some best practice interventions are encouraging physical therapy and offering psychological counseling. Some educational talking points are post-stroke rehab plans, medications and stroke prevention, emotional and psychological support. The immediate response for a nursing intervention is upon arrival at the emergency department, they need to undergo imaging to confirm the CVA diagnosis, and there's stroke times that the nurse needs to do. So in this, there's the immediate medical response upon arrival at the emergency department. Mr. Gates underwent a rapid assessment and imaging to confirm the diagnosis. Pharmacological management is administration of appropriate medications to manage blood pressure and reduce the risk of clot progression. There's also rehab services, initiation of physical and occupational therapy to address motor deficits and promote functional recovery. Then there's patient and family education, provision of information regarding stroke prevention and recognition of symptoms, lifestyle modifications to mitigate future risks. All right, so the definition of powerlessness is helplessness and loss of control over one situation. You want to empower the patient with knowledge, making sure that they are educated on what's going on. A lot of times that can kind of help them feel like a little bit more sense of control of what's going on. You would provide supportive care and setting achievable goals. Intervention for a 20-year-old with schizophrenia is educate the patient about schizophrenia, its symptoms, and treatment options, and to increase insight and adherence to their therapy. Teach techniques like mindfulness, grounding exercises, and relaxation methods to manage distress related to their symptoms. Some educational talking points is medication adherence and side effects, managing symptoms and recognizing early warning signs, building a report system. Powerlessness can happen when patients have chronic disease. Schizophrenia is a mental disorder that can cause the patient to feel powerless against their condition. Some interventions include empowering the patients with knowledge and provide supportive care while setting achievable goals. These achievable goals can create small wins that can create a snowball effect, which can improve the patient's feeling of self-control. Some educational talking points include medication regimens, managing symptoms, and recognizing early warning signs, and building a support system. A couple of nursing interventions include educating the patients about schizophrenia, its symptoms, and treatment options to increase insight and adherence to their therapy. Also, teaching techniques like mindfulness, grounding exercises, and relaxation methods to manage the stress related to symptoms can improve the patient's condition. We're going to go over intimacy. Intimacy is the ability to form close personal relationships. Another aspect that chronic disease affects is the patient's ability to form intimacy. Healthcare providers can provide counseling and open communication channels to help patients develop intimacy skills. Encouraging family therapy and support groups can also give patients the tools necessary to overcome issues with forming intimacy. A nursing intervention for a 31-year-old with bilateral paralysis is promoting independence and activities of daily living. This can be done by collaborating with physical and occupational therapists to provide adaptive devices. Also, providers can educate on assistive technologies such as voice-activated devices or wheelchairs. Some educational talking points include maintaining intimacy and relationship quality, modifying physical activities for intimacy, and addressing emotional concerns related to changes in physical abilities. These topics can help the patient overcome the barriers, whether it be physical or mental, that prevent the patient from feeling that they can't be intimate due to their condition. Computer keeps freezing. Chronic disease, we're going to go over coping. Coping is the strategies that individuals use to manage stress and life changes. Chronic disease patients may have trouble coping with their ailments. They may have trouble coming to terms with the lifestyle changes they have to make due to their diagnosis. Coping is the strategies individuals use to manage stress and life changes. The important thing to know is that coping strategies can be built and learned over time. Not everyone has good coping strategies, but they can be something that learned over time. Some best practice interventions include cognitive behavioral therapy, which is a tool that can help build coping strategies. Also relaxation and stress reduction techniques can help the patient cope with stress, anxiety they may be feeling. An intervention that can be considered for a 54-year-old patient with bipolar disorder is medication adherence, educating the patient on the importance of taking mood stabilizers as prescribed while monitoring the side effects and possible toxicity. This is important because medication adherence ranges between 30 and 50% on bipolar patients with bipolar. Patients feel the symptoms reside and feel like that they don't need to take them anymore. And also patients do not like the side effects, which can be a barrier to them taking the medications. So it's important to educate the patients on the importance of medication adherence. Educational talking points include medication management, mood stabilization, identifying triggers for manic and depressive episodes, and building a strong social support system. We're going to go over self-management. Self-management is taking responsibility for managing one's own health and healthcare. The patient must be educated on their condition and build confidence to feel that they can manage the condition on their own. Some best practice interventions include self-monitoring of the symptoms and health indicators, as well as educating the patient on programs and self-management tools. An important nursing intervention for a 12-year-old with type 1 diabetes is how to manage their own blood sugar. Type 1 diabetics require insulin and need education on how to administer their own insulin. Providing step-by-step guidance on how to administer insulin injections or use the insulin pump is important. This includes time, dosage adjustments, and site rotation. This is very important on adolescents due to patients being at school. It is important that the patient feels confident being able to handle their medications on their own because they're not always going to have their parents there to do it for them. Educational talking points include insulin management and glucose monitoring, healthy eating habits, physical activity, recognizing symptoms of hypo or hyperglycemia. All right, we're going to go spirituality. Spirituality refers to a personal sense of connection to something greater than oneself, which may include beliefs about purpose, meaning, and interconnectedness. It can play a crucial role in coping with illness, reducing stress, and enhancing well being. Spirituality is often linked to better outcomes, health outcomes, such as improved emotional resilience, pain tolerance, and overall quality of life. This is different than religion. Um, these are two very distinct concepts. Spirituality is a broad personal experience that may be or not that may or may not involve religious beliefs. It can include meditation, mindfulness, nature, music, and personal reflection. Religion typically involves structured practices, doctrines, and faith. Attending church, following religious texts, and engaging in communal worship. For individuals with chronic conditions, spirituality can provide a source of hope, resilience, and emotional support, even if they are not religiously affiliated. Some educational talking points are managing pain with holistic practices, um, and exploring spiritual practices for comfort and coping with emotional impact of chronic pain. We're gonna an intervention for an 85-year-old with arthritis. You want to encourage mind-body practices aligned with their spiritual beliefs. Guide the patient through meditative prayer, mindfulness, or deep breathing to promote relaxation and reduce the pain perception. All right. An important aspect for providers to consider is educating both the patient and their family on the diagnosis and treatment plan. It is important for the provider to assess the patient's educational level and communicate at their level. Use clear and simple language to eliminate any confusion. Always encourage questions for clarification and ensure they comprehend and understand what you are saying before moving on. For an 8-year-old with asthma, the the patient on I'm sorry, an intervention for an 8-year-old with asthma. We can educate the patient and the family on asthma triggers and how to prevent them. You can teach the child and the parents what can possibly be triggering the asthma, whether it be dust, pollen, pet dander. We can encourage air purifiers, dust-free bedding, and allergen-free environments at home. Some educational talking points include recognizing the asthma triggers, proper use of inhalers, the importance of adhering to medication schedule. All right. Social support is the presence of friends, family, and others who offer emotional and practical support. Social support is another aspect can be considered that can be considered with patients with chronic disease. Social support deals with the presence of friends, family, and others who offer emotional and practical support. Best practice interventions include encouraging group therapy or supportive networks, also connecting patients to peer support groups. Interventions for a 14-year-old with depression can include implementing healthy coping mechanisms like journaling, art, or music therapy, promoting social support by encouraging the teenager to engage in hobbies and staying connected with family and friends. A few educational talking points can include teaching coping strategies for managing depression, encouraging social engagement and physical activity, and, excuse me, and emphasizing the importance of family support and communication. All right. Adherence is the extent to which patients follow prescribed medical treatments. Certain ailments like obesity are hard to get patients to adhere to care plans. The patients do not see results right away, which can be discouraging. This is why it's important to have regular reminders, simplify the regimens, and address side effects. And you want to set short term goals. I find that when you set those short term goals, they have something to look forward to, and when they reach that goal, whether it be like a weekly goal or bi-weekly goal, it's something that kind of keeps them motivated, keeps them going. An intervention for a 21-year-old with obesity is educating them on macronutrients and their effect on body and weight loss. A lot of people don't know the difference between carbs and fat and protein, and how your body reacts to those is important to know when losing weight. You want to encourage physical activity and educate the importance of sticking to exercise routines. Some talking points include developing a sustainable exercise and diet plan, overcoming challenges to weight management, and setting realistic goals for weight loss. All right, so the definition of culture is the shared beliefs, values, and practices within a community. Health disparities is the unequal access to healthcare resources and outcomes based on cultural and socioeconomical factors. Best care interventions include providing culturally sensitive care while addressing health disparities through advocacy and education. An important thing to note when intervening on a 27-year-old with sickle cell anemia is taking the time to understand the patient's cultural background, their beliefs about the illness, and then their traditional healing practices. This can include asking the patient how they view their condition, whether they follow any traditional treatments, and then their preferences in medical decision making. Some educational topics to consider in pain management strategies is including pharmacological as well as non-pharmacological strategies. You can also discuss and educate the importance of hydration and avoiding triggers. Lastly, understanding the patient's cultural perspectives on health is something that is important to when you're when you're dealing with these chronic disease patients. Family caregiving refers to the unpaid assistance and support provided by family members to individuals with physical, emotional, or cognitive challenges. Caregivers are often relatives who take on various roles to help their loved ones with tasks that they can no longer perform independently. These tasks can include activities of daily living like dressing, bathing, cooking, and cleaning, as well as medical or therapeutic care such as administering medications, managing chronic conditions, or providing transportation to medical appointments. Family caregivers may care for individuals who have a wide range of conditions, including chronic illness, physical disabilities, mental health issues, developmental disorders, or age-related health declines, such as dementia or Alzheimer's disease. Important aspects include emotional support, physical support, medical support, coordination of care, and financial and legal responsibilities. Nursing intervention can be arranging respite services and collaborating with local agencies and support groups that can care for a child with autism. Educating on caregiver responsibilities, self-care techniques for managing autism-related behaviors can improve time management and organization. The caregiver can feel better equipped to balance caregiving responsibilities with other aspects of life, leading to less stress and increased efficiency. Enhanced emotional well-being. The caregiver experiences reduced burnout and improved emotional resilience by prioritizing self-care and seeking support. Effective behavior management. The child's autism-related behaviors are better managed through the use of evidence-based interventions and strategies, leading to improved family dynamics and a more structured home environment. Increased family engagement. The caregiver receives support from family members, ensuring a more shared caregiving role and fostering stronger relationships. This comprehensive approach to supporting the part-time caregivers of children with autism allows them to maintain balance in their own lives while ensuring their child's needs are met with compassion, understanding, and then also providing culturally sensitive care. Chronic care features long-term management, educational self-management, regular monitoring and focuses on individual conditions. Integrated care features coordinated services, is patient-centered, a holistic approach, and improves continuity of care as a collaboration. So some factors to consider with Medicare is eligibility. Chronic care refers to the management and treatment of individuals with long-term conditions that require ongoing care and support. The integrated care refers to a holistic approach that coordinates and combines multiple services and healthcare providers to address the complex needs of patients, particularly those with multi-morbidity. Key features to chronic care include long-term management, patient education, self-management, regular monitoring, and focus on individual conditions. Key features integrated care include a coordinated service, patient-centered, and holistic approach with collaboration and continuity of care. Medicare is typically available for people that are 65 years or older, people under 65 with disabilities who have received Social Security disability insurance benefits for at least 24 months. Individuals with end-stage renal disease or ALS are also eligible regardless of age. Coverage. Medicare is given into different parts. You have Part A, Part B, Part C, Part D, all dealing with different inpatient, outpatient services. Medicare Advantage plans is also private insurance plans that are approved by Medicare. And then you can also have a prescription drug coverage under Medicare. Medicaid eligibility. Eligibility is based on income, family size, disability, pregnancy, and then some other factors. Low-income individuals and families, including children, pregnant women, elderly individuals, and people with disabilities are eligible. States have expanded Medicaid under the Affordable Care Act to cover all audits with incomes up to 138% of the federal poverty level. And this is also dependent on the state. Medicaid covers a wide range of services that include hospital care, long-term services such as nursing homes, and then also that coverage can vary by state, but all states must offer certain mandatory benefits. I can talk. Primary care refers to the basic or general health care typically provided by doctors, nurse practitioners, or physician assistants who act as the first point of contact for patients. Primary care services are focused on overall health maintenance, prevention and diagnosis, and treatment of common illnesses and injuries. Regular screenings and assessments for chronic disease such as diabetes, hypertension, and heart disease. Utilizing evidence-based guidelines to diagnose and track the progression of chronic ailments, assessing lifestyle factors such as diet, exercise, smoking, and mental health to create a holistic patient experience. Engage patients and share decision-making to create individual treatment plans. They consider cultural, socioeconomical, and personal preferences when developing their care strategy. They encourage goal setting for disease management, such as target blood sugar levels and diabetes, and blood pressure and hypertension. They provide personalized medication plans and ensure patients understand the purpose of dosage of their medications. Monitoring for adverse drug interactions. They use medication reminders such as apps and pill organizers. They refer patients to specialists like endocrinologists, cardiologists, and things like that. Collaborating with nurses, pharmacists, dietitians, and therapists to provide well-rounded care. So, a 45-year-old male with recurrent cancer interventions, some things that you want to consider is pain and symptom management.